Hi, this is Dr. Shinwari from Elite Medical Center, and today we're going to talk about the coronavirus, which is fast becoming an international health epidemic. And I'm hoping that with this brief video today, we'll be able to answer some of your questions and also alleviate some fears and concerns that you might have. Now, the coronavirus is a family of viruses that generally cause respiratory symptoms, and these can range from mild cold-like symptoms to nasty chest infections and pneumonias. This virus is generally found in animals. However, some of these viruses have the capability of being transmitted to humans, and that is what seems to have happened at Wuhan, where the epidemic started when people came in contact with an unknown source at a seafood market. So far, there have been 4,500 cases reported in China with 80 fatalities. Fortunately, here in Australia, we only have 4 or 5 cases that are confirmed and diagnosed as having coronavirus. One of those individuals is from Victoria. The risk of transmission is generally pretty small for the average Australian. High-risk individuals would be those who present with respiratory symptoms and have also been in contact with other individuals returning from China or who have traveled to the Hubei province. So those cases would be, high priority in having them diagnosed early and treated and quarantined appropriately. I think the main thing is watching out for symptoms. Typically, as I said, most of these cases would present with cold-like symptoms, high temperatures, sore throat, cough, which unfortunately are very common symptoms seen in general practice on a daily basis. In terms of prevention, we are focusing on just basic hand hygiene, and that seems to be the case in most viral infections, including influenza. So basic hand hygiene, making sure that you minimize the risk of droplet infection when people are coughing or sneezing. So making sure that you cover your mouth, your face. There is no particular need for face masks at this point in time. However, if we did find a patient who was thought to be a high risk, we would offer them appropriate isolation, examination, and appropriate masks if necessary. The other thing you can do is just avoid unnecessary and unprotected contact with animals, and making sure you wash your hands thoroughly after contact with animals. Thirdly, it's important that you make sure that you are eating your meat well cooked and taking care of yourself and your families. At this point in time, there's no active vaccine or treatment for the coronavirus. However, the symptoms of the viral infection can be treated. Things like high fever, the need for antibiotics, or monitoring and observation. Here at Elite Medical Practice, if we're quite keen on hearing from you. If you feel you are symptomatic and you are at risk, please contact the clinic. We will make appropriate arrangements so that you are placed in isolation and examined thoroughly. So far, the reported cases, as I've mentioned, are quite small in numbers, so there is no need to panic. I think it is important that we all have a good sense of awareness of what the illness is and the symptoms to look out for, and when to sort of have that discussion with your doctor or your GP. We'll be in contact with you with further updates as things come along. In the meantime, we wish you all good health and hope you remain safe. Thank you.